Some of the common symptoms. Headache is the #1 symptom. So they will tell you that they have a headache. They may describe it as pressure in the head. It may not be anything terribly severe. They may feel nauseated. They may feel the need to vomit. And I will tell you that that sign always bothers me a little when I'm evaluating an athlete, because that can indicate that there's a rapid rise in pressure occurring in the brain, or it can indicate that there's irritation of the meninges. So an athlete who really starts to get sick on the sidelines, I think you should make every effort you can to move that athlete to a level of higher care. They may experience dizziness or balance problems, and they'll tell you they feel dizzy, but most of the time what they mean to say is that their equilibrium is off and they feel like they're just not on balance. Blurred vision, photosensitivity, so that they don't like bright lights. There may be acoustic sensitivity, where they don't like loud noises. Very difficult concentrating, and again, their affect there will be a change in their affect, and they may feel down, they may feel groggy or like they're in a fog. So when we do a sideline evaluation of head injury, and really this is largely when I do this sideline evaluation or the athletic trainers do a sideline evaluation, you take a review of their symptoms by simply asking them, do you have a headache? Do you feel dizzy? Do you feel nauseated? Do you have blurred vision? You try to assess their level of orientation, and I'll give you some questions that will help us do that, some example questions. I will do a detailed head and neck evaluation, so I'll take them through cervical range of motion, and I'll do palpation of their facial structures to make sure there's not a concomitant bony injury. A neurologic evaluation, again performed by a healthcare professional. We will do assessments of memory and cognitive function. Memory, and again I'll tell you some little tricks that we use. Cognitive function, you may ask them to do some simple math tricks, things like serial sevens, where you start at 100 and you subtract 7 in serial increments. But make no mistake, I think that the message that is very important for me to deliver to you today is that athletes with signs and symptoms of a concussion are to be removed from a contest. And if you happen to be I saw the show of hands of some of you that are out there on the sidelines without an athletic trainer, maybe without a paramedic staff, maybe you represent the highest level of authority, then just remember the axiom, when in doubt, hold them out. Because I really think that is certainly the message we are receiving from the organizing bodies above. So here's what I think are practical questions for you as coaches to ask if you happen to be the person that's doing the evaluation. Of course, not only do we have situations where you may not have an athletic trainer, but there are oftentimes not trainers at freshman games and at junior varsity games. So the coach may be the person that really is best qualified to do that assessment. So again, you ask the questions, are you having any of the following symptoms? And then to get a level of orientation, ask them what their venue is. Where are we playing tonight? Where did we play last week? Who did we play last week? So the simple things of tell me your birthday, tell me your sister's name, most of the time they can get those, no matter how concussed they might be. But if you impart something that makes them have some level of recall over more recent events, it's a more accurate way of testing. To get them to do some mental processing for you, ask them to say the days of the week in reverse order. So starting with that particular day, Friday, Thursday, Wednesday, Tuesday, Monday, Sunday, Saturday, etc. Or have them do the months of the year in reverse order. Pick out a word, perhaps, that you'd like them to spell in reverse order. World is one that is commonly used to ask the athlete to spell a word like that in reverse order. And then to assess their immediate memory, ask them a 3-word recall. For me, it's always cat, ball, and umbrella. So I'll ask the athlete at the beginning of my exam to remember those 3 words, to repeat them to me right then, and then at the end of my exam, I'll come back a few minutes later and I'll say, what were the 3 words I asked you to remember?